Okay, good morning everyone. Welcome to the HMIS Case Management Notes training. Today we are going to go over some new documentation for HMIS and talk about kind of the history and why we're making the changes. Hopefully, maybe you know my voice, but maybe you don't. So this is Jess. So if you have any questions after today's training, please call the data support line at 9999, or you can email us at data@coloradocoalition.org, and that information will also be at the end of our PowerPoint presentation today. So just a couple of housekeeping notes before we get started. Everyone on the webinar today is muted, so your lines are all muted, so if you say something, no one else can hear you unless there's someone in the room with you. So if you have any questions while we're going through the information today, please submit your questions through the chat panel. And you can get to the chat panel by going to the little control screen for GoToMeeting and clicking on the orange arrow, and that will show you all of the participants and then also show you the chat panel, and you can type in your question there and we'll answer questions through the chat panel. I also would ask that if you are logged in as just one person and you're sharing an office with multiple people who are all on the webinar with you, go ahead and send their names through the chat panel so that we can get everybody marked as attending. We did already get that information from FSS, and I can see that from a couple people who logged in all together. So if you just have multiple people listening on the phone together and you didn't all sign in together, go ahead and send us your names through the chat panel so that we can mark you down on the attendance sheet. Hopefully you all got the email yesterday that has the PowerPoint presentation that we're going to go through today. If you didn't get that, you can also send in your put in your email address into the chat panel, and we will send you the PowerPoint after today's webinar. Another upcoming training that we have available, this is the last case notes training, so hopefully your entire team has been able to attend. This is the last one that we're offering. We might offer one makeup training later if we get enough requests for it, but as of right now, this is the last one scheduled. So we do have an open lab scheduled on January 7th, and the open lab is a training time where anyone can come to the QA Training Center and use the computers and ask questions. So if any of you feel that you need some additional assistance or sometimes kind of sit down with a trainer and go through HMIS or ELF questions, you can sign up for the open lab on January 7th, and Glenn will be available on that day to work with you or help you with putting in case notes into HMIS or looking through the group services page, or also registering clients in EPM if you need assistance with that as well. So, so go ahead and you can sign up for the Open Lab on January 7th through the wiki page on the intranet. So, all right, we're going to go ahead and get started here. And again, if you have any questions, please submit them through the chat panel, and we will have an audio Q&A at the end of the webinar. So I'll unmute everyone's lines then, and you can ask any questions that you didn't get a chance to submit through the chat panel at that time. So for today's agenda, we're going to talk about why are we making this change now. Again, as I said at the beginning, this case notes training is for some changes in the process and how we document in HMIS, and so we're going to talk about why we're making this change. We're going to talk about a couple of exceptions to the rule, and we're going to go over some of the basics of writing a good note, show you how to do a case note in HMIS, and then we're going to talk about how you add services to a case note, and then finally we will go over using the group sessions page. So something that's not an objective today is to determine how you can write the appropriate note for your program. That's something that you can talk about with your supervisor, your program manager, or director, and that is not my area of expertise. So I'm focusing on the actual technical how-to, so how do you actually get into the system and follow this documentation process. And if you have questions about the clinical aspects of documentation, those are good things to take up with your supervisors who are a lot smarter than I am. Okay, so why change now? So the quality assurance and billing departments are trying to move all of the case managers off of paper route slips. So hopefully you have gotten a message from your supervisor or director or your manager that you no longer have to submit paper route slips as of January 1st of this year. So we're no longer using paper route slips and for case management. And so in order for us to really be able to do this successfully, we have to kind of standardize how everyone enters information to HMIS, because we need to be able to count those services in a sort of logical and automated fashion. And so HMIS is where obviously we are going to be documenting all of our non-clinical case management services. And this entire training is about how we're standardizing that documentation in order for us to be able to keep all of the departments off of paper route slips. And I should clarify, it's not all departments. It's most programs, most case managers. There are a few exceptions, and we'll go through those in a minute here. But the case management activities, the non-clinical case management activities, are going to be documented in the case notes page in HMIS. And as always, our billable therapy activities are charted and documented in EHR. So there's you do not need to document billable therapy activities in HMIS. If you were previously documenting your clinical, billable therapy activities in EHR and then also documenting those on the services page in HMIS, I would recommend that you talk to your supervisor and just verify with them that you no longer have to do that. However, just from the quality assurance team, from data, we no longer need those services documented in HMIS. In the past, they were being used for purposes of showing services for the APR. However, we've come up with a different solution for that, so we don't need clinical services documented in HMIS anymore. However, there might be a reason that your supervisor wants you to continue documenting those sessions in EHR and HMIS. I can't imagine what that reason would be, but before you stop doing it, I would make sure you talk with your supervisor so that you can be sure that you're following their expectations. But as far as the quality assurance department and billing departments are concerned, we no longer need you to document billable therapy services, EHR and HMIS. Those can just be documented in EHR. So every week or month, depending on how the process goes, the data team is going to send a report to billing, and they will enter your case management with client present case note services into EPM. So this report is taking the place of paper route slips. And so in order to do this, we obviously need to ensure that all of the clients are registered in EPM, because if they get a report for all of the case management with client present services on a client who's not registered in EPM, then those services kind of go nowhere. There's nowhere to enter those. There's nowhere to attach those to a client that doesn't exist in EPM. So just as a clarification, EHR and EPM are the kind of two systems that we call ELF. So you might be familiar with that. EHR is the electronic health record, and EPM is the electronic practice management system. And so The EHR is where a lot of the documentation happens, and EPM is kind of more the billing side of things for the electronic health records. If you have questions about that, that's kind of what those two things mean. So the reason that we're changing this, the reason that we're doing this is kind of twofold. We are trying to reduce the amount of paperwork required for case managers by ending the use of paper route slips, and we're also trying to reduce the dual data entry by no longer requiring that clinical services be entered into HMIS. There's also a major report that we have to submit annually to HRSA, the Health Resources and Services Administration. And this report is required because we are a federally qualified health center. So our status as an FQHC makes it, let's see here, it makes it necessary for us to document all of the case management services that we provide to our clients over the course of the year so that we can report on those services to our funder, HRSA. So some people might be wondering, you know, I never did paper route slips, so what do I care? Or, you know, I don't work at the clinic, so it doesn't matter to me if we're a health center or not. The interesting thing is that HRSA, the funding from HRSA is spread throughout the organization, and the federally qualified health center does not just apply to our clinic. It applies to all of the sites within our scope, which for the most part is every program site at CCH. So every program site, when we're providing case management or clinical billable services, we are covered under our FQHC status. And so we want to make sure that we're able to then take those services that are provided as an FQHC and report on them to HRSA to show them the types of services that we are providing to our clients. And so the report is really, it's a significant undertaking, and it requires a lot of cooperation between the program staff and the clinic and the billing department and quality assurance, and so there's a lot of information that goes into this UDS report, the Uniform Data System report that we provide annually to HRSA. So it shows the clients that we serve over the course of the year, the types and quantities of services that we provide to those clients, our staffing mix and tenure. So it shows, you know, here's the number of medical assistants that we have, here are the number of clinical case managers that we have, or it actually breaks it down by, you know, LCSW or CACs or case managers, outreach workers. So it breaks it all down and says, you know, we have this many LCSWs who've been with the organization for 2 years or longer or whatever. So kind of the staffing mix and tenure. So what kind of staffing mix are we using to provide the services to our clients, and how well are we maintaining constant contact with our clients and consistent contact by you know, keeping the same staff in the positions. And then it also reports on the quality of care delivered. That is, the quality of care measures are all medical measures. And then it also goes into a variety of financial details about the cost of actually providing these services. So the report is massive, and it requires a lot of cooperation, and also it requires us to take into account a variety of different reporting methods and pull all of that information together, because obviously your tenure as a staff person isn't documented in HMIS, so that has to come from HR, and your you know, your licensure isn't documented in HMIS, so that has to come from billing or from the ELF system. And the medical quality of care measures that your clients receive from the clinic is not documented in HMIS. So you can see how there's a lot of different aspects of this report that we have to pull together. And so in order for us to accurately reflect our patient population and all of the services that we've provided to our clients over the course of the year, we really have to standardize the way that we document in HMIS. And this is going to allow us to report more accurately and more consistently year by year. So currently we're using many, many different systems. So we've got, our ELF system, we've got our HMIS system, we've got our accounting software, and we've got some spreadsheets that we use, and we've got, handwritten documentation with clients' names and dates of encounters listed on them. So we have all these different systems and different together, and then we use all these different methods to try to pull the numbers accurately, and it's really difficult to give an accurate count of the people that we're serving and the services that we're providing to them because of this widely varied data collection system that we're using. So your help in documenting in a standardized way is going to help us ensure that we can report accurately, and also that we can understand any trends in the population that we serve so that we can provide the best services that are needed for that population, and then that we can also speak honestly to our funders about the types of services that we're providing and the methods that we are using to provide services in order to meet the needs of our clients. So hopefully that helps you understand somewhat about why we're making this change. On one side, there was a lot of duplicate documentation, and on that same side, with kind of the extra work for the case manager, there was a lot of, the paper route slips going back and forth, and confusion with the billing department calling and saying that they can't read your route slip or whatever, or route slips getting lost, and then on the other side, there's the reporting aspect and the difficulty in really being able to describe the work that you're doing to our funders to help them understand the needs of our clients and the work that you're doing to help our clients progress. So there's kind of a a multifaceted approach here to making this change and making sure that in the future we're able to really accurately and consistently represent the clients that we serve and the services that we're providing to them based on that need. So that's the background for why we're making the change, why we're moving away from paper route slips and instead moving to documenting non-clinical billable services in HMIS on the case notes page. So now we're going to talk about the exceptions to the rule. So, it wouldn't be CCH if we didn't have somebody doing something different when everybody else had to do it one way. So here are a few of the exceptions. PATH is not going to be documenting in HMIS because their SAMHSA has not approved the regulations yet for their entry into HMIS. So they'll continue to document case management on paper and deliver those route slips to billing. They will continue to do that until their regulations are approved and SAMHSA allows them and requires them to enter and document in HMIS. At that point, they will stop using paper route slips and begin entering in HMIS through the case notes page. Quig Newton and patient navigators will not be documenting in HMIS. They will continue to document their case management on paper and route slips to billing. And outreach will continue their documentation practices until further notice. So there has been some discussion about outreach changing their documentation practices. However, at this point, they're going to continue with their current documentation practices, which involves entering services on the services page, and they will do that until some other method is determined for them. And community sources and family resources, if you are providing bus tokens only to a client, you will continue your current documentation practices until further notice. So the case notes page is really a place for us to document one-on-one, face-to-face case management encounters with a client. And providing a bus token is not a face-to-face case management encounter. It's really sort of just a distribution of tokens. So that, as an example, would be an exception where they would just continue to document with their current practices and not enter that information on the case notes page, unless, of course, they did provide a face-to-face case management service, in which case they would then document that on the case notes page. And as I have mentioned and will continue to hit you over the head with this information for the rest of this webinar, the documentation in the HMIS case notes page is only for one-on-one, face-to-face encounters with clients. So these are the only kinds of encounters that we can submit to HRSA for the UDS report. HRSA is not saying that other types of encounters with clients are invalid or that those types of things aren't necessary for client engagement. But what they are saying is we want to know what you're doing with these one-on-one, face-to-face encounters. And so they just don't count the other types of encounters that we have with clients over the course of the year. And it's not saying that you should stop doing those things or that they're not important. It's just that we don't count them in our reporting, and so the documentation for those things is going to be slightly different. So non-clinical group services, obviously, since they're group services, they're not one-on-one, face-to-face encounters. So they cannot be counted. And so as we have done in the past, clinical therapy groups are going to be reported in ELF, and any other non-clinical group services are going to be documented in HMIS on the group services page. So education groups or community groups, those kinds of things are going to go in HMIS through the group services. So any non-clinical group services will go into HMIS through the group sessions page. And this will include those services on your case manager productivity report so that your manager can see those services that you're providing as part of your productivity. However, it's not going to affect our UDS reporting. So we won't have to separate those things because they're being reported in a different manner than our one-on-one face-to-face encounters, which we're entering through the case notes page. Okay, and I just want to, well, let me finish this exceptions, and then I'll mention that. So in the past case notes training, there have been questions about what types of services, what types of groups would count as non-clinical groups. So what kinds of things would you document on the HMIS group sessions page? And the list that I have here is not comprehensive. It doesn't cover every possible group. But these are types of groups that are non-clinical that you would document on the HMIS group sessions page. So like a life skills group, any housing groups. I know some of you do newsletters. And so those newsletters can continue to be documented on the group services page. A community barbecue or a holiday event or any sort of program lunch or anything like that. Any other community gatherings, computer classes, etc. So all of those types of things will be documented on the HMIS group sessions page because you want to demonstrate that you are interacting with your clients and that you are doing what is expected of you. So these things will show up on your productivity report, but they won't affect our UDS reporting, which only counts one-on-one, face-to-face encounters. So if you are doing any of these events, obviously it's not a one-on-one face-to-face encounter, so you would document them in the HMIS group sessions page. If it's a clinical group, or a therapy group, you would definitely document that in ELF. Okay, so I just wanted to remind everyone that you're all on mute, so you can only hear me, so I get to talk at you for an extended period of time, but you can't hear each other and I can't hear anything you're saying. So if you have any questions during the course of the webinar, please type them into the chat panel and we'll try to answer them as we see them come in. I haven't had any questions yet, so I just want to give you a reminder that you can enter your questions into the chat panel for the GoToMeeting on the GoToMeeting control panel. So if you have any questions, go ahead and enter them through the chat function. And otherwise, we will have an audio Q&A at the end of the webinar. I'll unmute everyone's lines, and you can ask any questions that you need at that time if you can't find the chat feature or you don't feel like doing it through the chat. So, so far we have covered the kind of why we're making this change in documentation. I really hope that I was clear about that. You no longer need to submit paper route slips for case management encounters, unless, of course, you're one of the exceptions to the rule. And we're really doing this as a way to standardize our documentation for reporting purposes. So, so if you have questions about that, I would be happy to address them, or we can talk about them during the audio Q&A later. So we talked about the why we're making these changes in our documentation, why we're standardizing our documentation for HMIS, and then also we went through who are the exceptions to the rule. So who are the exceptions to the standard that we've set. So next thing we're going to do is talk about writing a case note. And as I mentioned at the beginning of the webinar, writing the appropriate case note for your program is not my area of expertise. What the next few slides I'm going to show you, if you were here last fall during the ELF training, you'll recognize these. Laura Dykes and Tim Marshall put these together. And I'm just basically going to read through kind of the do's and don'ts for writing a good case note. I'll try to give examples where I can, but again, I work with computers and not with people, so they don't always respond the same way. So if you have questions about good documentation, I would really recommend that you work with your supervisor or your manager and ask them to sit with you while you write your first few notes or to review your notes as needed so that they can provide feedback on appropriate documentation. This is just a basic list of do's and don'ts, and again, it's not my area of expertise, so I would highly recommend if you have questions about the things that I'm saying to take them up with your supervisor. So let's get started. So writing a case note. Do think about what needs to be shared. So when you're documenting on a one-on-one, face-to-face encounter, it's really important that you consider the information that's necessary for someone to know about that encounter that really applies to the client's progress. And that could be their housing goals, their personal goals, whatever that is. You want to make sure that you're just sharing what needs to be shared. So for example, if there's a dog at the apartment and you're a dog hater, that's not necessary information. Now, if the client's lease agreement specifically prohibits pets in the apartment, that definitely is relevant information. You would want to share that in your documentation. Make sure that you're entering the case note under the correct program in HMIS. We'll take a look at the system here in just a few minutes so you can see how you do that. How do I verify that I'm entering this under the right program? Because you definitely don't want to document your case note under someone else's program entry. Make sure that you're documenting the client's strengths and also documenting any patterns of dysfunction that you see. So on the list of don'ts, don't use slang or acronyms or made-up abbreviations. So obviously, I think that like I said, all of this information is not my area of expertise, but you all have your professional judgment that you can use when you are writing, when you're documenting on a client's chart. So if you have, like CCH is an acronym. However, I think that most anyone who was to review your case note would understand that CCH stands for Colorado Coalition for the Homeless. So, there are appropriate acronyms and inappropriate acronyms. If I had gone through this entire training and I just said, oh, okay, yeah, well, we're going to, document an EHR at this time, and that way we can pull reports and enter them into EPM, and that way we can report to HRSA, and this all maintains our status as an FQHC, and you read what I just said, you might say, I don't know what you're talking about. This doesn't make any sense to me. And so it's really important to just, make sure that you're using acronyms or abbreviations that are easily understood by anyone else. So if you were to, just unexpectedly need to take a leave of absence and someone else had to take over your caseload, you need to use language in your documentation that would make sense to that other person. So when they take over your caseload, they can easily look through your client records and understand the progress that you have made, that the client has made as you've worked together, and they can understand kind of where that person's at and what their needs are. So don't use the case note documentation to complain about a client or use it as a platform for political beliefs. All right, so we've got another slide of do's and don'ts I'm going to go through here. Be concise. Again, this kind of goes back to just sharing, understanding what needs to be shared. It's important that you are thorough and concise. So you want to include all of the necessary information and only the necessary information. Be objective. Check your spelling and grammar, and luckily for us, HMIS has a spell check in it, so we'll take a look at that. So, but it's really helpful if someone else is reading your note that you, have everything spelled correctly and have proper grammar and punctuation and things like that. Consider your audience. So, an example that I like to think of is, I'm sure a lot of you have have gotten an ROI and released your case notes for a client to their lawyer or something for their Social Security hearings and things like that. So just think about your note being used, being read in front of a court. And really, make sure that the information that you're providing is professional, accurate, concise, necessary information. And another side of this, consider your audience, would be to think about the fact that the other people who are going to be accessing your client's record, for the most part, are people who do what you do. So they, other case managers, other direct service providers are going to understand things that people like myself who work with computers maybe would not understand as well. So consider your audience when you're writing your case note and document appropriately for the audience. And summarize your general progress. Well, it's not your progress, I suppose. Summarize general progress with housing goals. I would also say, any kind of personal goals and any other types of goals that you are working on or that you've set with a client, make sure that you're documenting that progress. And then some more don'ts. Don't use other clients' names or other people's names in the notes. So it's really important that we don't violate the privacy and confidentiality of other people in our clients' notes. So you want to make sure that if you are, if it's pertinent to your note that, Tommy's brother Joe was in the apartment when you went over for a home visit, then you can just say Tommy's brother was present. You can refer to that person by their relationship to the client rather than using the other person's name. So just make sure, consider other people's privacy when you are documenting. Don't over-document unnecessary information. We talked about that briefly already. don't go into depth regarding a client's mental health condition. Again, if you are doing a therapeutic billable session, that needs to be documented in ELF, and a HMIS case note is not the appropriate place for that. So again, this is for one-on-one, face-to-face case management visits, so non-billable visits. And finally, don't be judgmental. So an example I think that I heard Tim use last fall was, somebody types in all capital letters, client was drunk, exclamation point, exclamation point, exclamation point. That conveys some kind of judgment in saying that. So you want to make sure if it's, I would assume that it's probably always necessary information to document and, substance use, especially if it's in one of the dry or clean programs, but you want to make sure that you are not conveying any judgment, and instead you are just documenting necessary information. So you can say the client was inebriated and whatever, and go on about documenting everything that occurred during your one-on-one face-to-face encounter without really being judgmental in your documentation. Okay, so those are the do's and don'ts of writing a case note, and that information was provided by Laura Dykes and Tim Marshall. So if you have any further questions about appropriate documentation, again, I'm really going to recommend that you work with your supervisor or manager and have someone shadow you or work with you on your documentation to make sure that you are documenting in a way that meets your program's expectations. Okay. Now we're going to move on to how do you actually write a note in HMIS. We're going to look at the system here in a second and go through the process of putting the note into HMIS. So there are some fields on the case notes page that we have to fill out, and we're going to talk about how you fill out each of those fields. So we'll start off with the activity field. This field is a drop-down that provides only 4 options. Those 4 options are case management with client present, case management telephone, case management no contact, and case management other. Those are the only 4 options that you have because we are, in the case notes page, we are only documenting non-clinical, one-on-one, face-to-face case management encounters. So all of your encounters that you're documenting on the case notes page will fit into one of these categories. So when you're looking at HMIS, you can see the red circle here is where we have our, where we would enter the activity. And there, when we drop down that menu, it's going to say CM client present, CM telephone, CM no contact, or CM other. And we will choose whichever of those is appropriate. So the case management client present is for a one-on-one, face-to-face encounter with your client. The case management telephone is a telephone call where you are speaking to your client. Case management no contact is a way for you to document no-shows. So you want to, it might look suspicious to your supervisor if they're reviewing your productivity report and they say, wow, you haven't contacted Sharon in the last 3 months. What's going on there? Why is this person on your caseload if you're not having any contact with them? So this is a way for you to document that you have attempted to contact someone, but maybe you went to their house and they weren't there, or you scheduled an office visit with them and they didn't show up. So the case management no contact is for kind of a no-show situation for you to document your attempts to reach out to a client, but maybe their lack of engagement. And then finally, case management other would be anything else. So any other case management service that you provide that doesn't fit into the client present, telephone, or no contact. So an example might be if you are calling another agency or calling someone on your client's behalf. So you're not having a face-to-face encounter with your client, and you're not on the phone with your client. So it can't be case management client present or case management telephone, but instead you're on the phone on your client's behalf with someone else in order to meet your client's, in order to help meet your client's needs. So that would be an example of case management other. Next, we have the subject line. The usage of the subject line is determined by the program, so let's take a look at that here. Here is the subject line. That is where you would enter the subject of the note. And the subject, again, like I said, this is kind of, the usage is determined by the program. So there are different programs that use the subject line differently. We're not stipulating how you have to use this line, but some people use it to document the location of the encounter. So this was in the client's home, this was in the office, I saw them on the 16th Street Mall, we met at Starbucks, whatever. They use it to document the location. Other programs use this as a general overview of what's actually contained in the note. So there are lots of uses for this subject line, and I would, you can use it however you want, though I would highly recommend that every program do it consistently. So if you all want to use this as the location, then everyone in your program should use that field as to document the location. So just make sure you're doing it consistently with the other members of your team. And again, this is just for consistency's sake, so that when if anything happens and you're out of the office and someone needs to take over your caseload, that they can easily review your client's documentation and understand where kind of where things are at. So I have a couple of questions, let's see here, that came in through the chat. So let me go ahead and answer those questions. Someone said, when you say face-to-face encounter, it sounds like that does include telephone, like an EAP session. Is that correct? This would be a great example of not using acronyms, because I have no idea what EAP means. But a face-to-face encounter would be when you are actually face-to-face with your client. If you're on the phone, you would use a case management telephone if you are on the phone with your client. The next question, via telephone, where you cannot leave a voicemail or don't get an answer or have left a message, should this be recorded under no contact? Yes. So if you do not make contact with the client, you didn't speak to them on the phone, you didn't see them face-to-face, that is a no contact. Let's see here. In terms of productivity tracking, when documenting a client no-show, what time should be documented for this? For example, if I, as a clinician, have blocked out a time frame of 1 hour and a client no-shows, what should I reflect this 1 hour in this no-show note? So that's a great question. I would recommend that you ask your supervisor about how they want you to document that information. My best guess would be that you would document the actual amount of time spent. So if you spent 15 minutes trying to get a hold of your client, or trying to kind of track them down, I would put 15 minutes as the amount of time for that no-show. And then you've got, lucky you, an extra 45 minutes for admin time or for noting, or whatever else it is that you need to do. So that would be my recommendation, but I would really say that's a great question for your supervisor. And again, that would just be something where I would say, make sure that your entire program chooses to do it the same way. So for consistency, it's easier for you, it's easier for your managers, and it's easier for us who do all the reporting if everybody kind of chooses to do that the same way. So hopefully you all got an answer to your question. If you didn't, maybe try to rephrase it, throw it back in the chat panel, or wait until we have the audio Q&A, and I'll try to address them more thoroughly, or I'll tell you to ask someone else. All right. Let's see here. Whoops. Let's go back to our PowerPoint presentation. And the next field that we need to fill out is the duration in minutes. So the units field, and I just want to emphasize this is the time in minutes. So you can see here on the screen, this is where we would enter the number of minutes spent. So if you think about this, the case notes page, as a place where we're kind of documenting our non-clinical case management services, this case note is the umbrella of case management. And under this umbrella, there are many, many services that you can provide. So during a case management encounter, you might provide any number of different services, but the entire thing fits within the realm of case management. So hopefully that makes sense. So you want to document the amount of time spent in the umbrella of case management. So I spend 60 minutes with my client. 20 minutes I'm doing some review of places where my client can take their GED, and we're also looking over and kind of spell checking their resume, and then I also give them a ride to an interview. Okay, so during this 60 minutes, we do a number of things. So we provided some education assistance, some employment assistance, and some transportation assistance. All of those are part of my face-to-face encounter with my client. And so I'm going to document the entire 60 minutes in the units field here, and I will add those services as a part of my case note later. So I'll show you in a second here. I'll show you how we would kind of divide this umbrella case management service out into multiple different service types. But this is where you document the units of service, and that should encompass the entire amount of time spent with your client during that encounter. And then finally, we've got the notes section where we enter the narrative, the actual documentation. So this is the big area down at the bottom where we can enter in the notes, so the details about the encounter with our client. So you can attach services. You know what? Actually, well, no, we'll go ahead and do this. So you can attach services that you provided to your case note. So it kind of shows that during this case management encounter, here are all the separate types of services that I provided. Just keep in mind that there's no duration associated with those separate services that you attach to the case note. Instead, the case note includes the entire duration, and each service is just there as a representative of time or of service provided. So on the case notes page, you can see down here in the lower right-hand corner, there's an area where you can choose the type of service you provided. So in my example, I would have said I spent 60 minutes doing case management, and I would here choose education assistance, and then I would click this little arrow, and that would populate down here. And then I would say I also did, whoopsie, all sorts of problems. So I did my 60 minutes, I already did my education assistance, that's down here, and then I would say I did my employment assistance, click the arrow, and then that would show up down here, and then I would choose transportation assistance, click the arrow, and that would show up down here. So I've got this one activity of case management client present that lasted 60 minutes, and during that time, I did all of these things. So hopefully that makes sense, and we'll take a look at that in HMIS here right now. So let me bring up HMIS. So one thing I want to clarify before I get deep into this in HMIS is that what we're looking at here is our training agency. So the information in here is fake. These are fake clients, they're fake programs, and even the services that are represented here are all fake. So all of this stuff is just a sample of just to show you what the system looks like. When you get into HMIS, when you're actually in the live database, you are going to see the 4 options of case management client present, case management telephone, case management no contact, or case management other. And you'll see all of the services that are available to your program in that services section in HMIS. So what you see here, what I'm showing you right now on the screen, might not be an exact match of the options you will see when you log into HMIS, and that's just because I'm in a trading agency and you're actually in CCH when you log in. So what I'm going to do is, so when I'm in HMIS, I am going to go to the case notes page. I'm just going to go straight there, and I'm going to search for my client on the case notes page. So right up here at the top of the screen, there's a search section. So I'll put in my client's couple letters of the first name, couple letters of the last name, and click search. And now you'll see that I am on, when I look up at the navigation bar on an HMIS right up here, I look up at this kind of orientation bar, I can see that I am on the case notes page. Whoops. I'm on the case notes page, and I'm looking at the, the emergency shelter program. I'm an artist, as you can see, so drawing straight lines comes naturally to me. And then I can see the name of my client listed here, and then I can also see their identifier. So this shows me the page I'm looking at, the program I'm looking at, and my client. So for my purposes for today, this is the correct client, but that's not the right program. So I'm going to go to the customer drop-down box and find my client in the program that I actually want to document in. So remember, when we were doing the do's and don'ts of good documentation, we said, do make sure that you are documenting under the correct program. So I'm going to do that by dropping down this customer drop-down menu, and I want to choose Donald Draper in the Family Transitional Housing Program. So I select the correct program, and now you'll see that this shows I'm on the case notes page in the Family Transitional Housing Program looking at my client, Donald Draper. That's exactly what I want. So that's an easy way for you to make sure that you're documenting in the right program. So to write a case note, I first click the New button, and that makes all these fields available for me to type into. The first field that you're going to see there is the consent. This has been confusing to some people. This consent field is simply a system consent, so it doesn't have to do with your client's consent or anything like that. It is really just kind of who can see what's on this page. And unfortunately, every time we hide this field, we get an error message. So we've just kind of left it there. It always automatically populates to group. Group is the only option in the drop-down, so you just don't have to worry about it. You can just ignore it. But the consent doesn't have anything to do with your client's actual consent. Okay, so the next field is the activity field. This is where you would see, when you're in the CCH database, you're going to see case management, client present, telephone, no contact, or other. Since this is fake information, we obviously don't have a training family transitional housing program. We're looking at a fake program, fake client. These are fake activities. So here it just says case management. So I'll choose that. And then the staff person, obviously this would be the person who is providing the service. So you would go ahead and choose yourself. I can't imagine a scenario where you would have someone else doing your documentation for you, but that might happen. I don't know. So you would choose the person who provided the actual service, the date and time. This should be the date the actual service was provided. So I'm going to say this was on, I wasn't in the office on January 1st, though I am very committed. This was on January 2nd. Then the units is the actual amount of time I spent with my client doing this case management service. So I'm going to say that was 50 minutes. My subject line, I'm going to say that we use it as the location, and so I can use that subject line however I want to. That's how I'm choosing to use it. And I am then going to type my note into the note section. So I go in here, start typing. I use really great spelling and grammar. And so you can see that there are red squiggly lines under each misspelled word in my note. So when I click out of that field or tab off of the note field, it brings up the spell check. And so I can go through just like in Word, and I can ignore it, or I can change that to, whoops. And so you can go through, you can do all your spell checking, and when you're finished, you can click the Save button. And again, as HMIS does, it doesn't actually ever tell you it's successfully saved, but if you don't get an error message, give yourself a pat on the back. And your case note will then show up in the case notes grid at the top right-hand side of the screen. So you can see I just highlighted my case note there, I can tell it's mine because the subject matches my subject and the date matches my date. So I have a question or two in, oh, just one question in the chat panel. I've not been able to add services to my case note for the past month or so. The add arrow is no longer highlighted, so I can't select it. I thought a system change was made. Am I mistaken? So, Carrie, that's a great question. And if the system were working properly, I would show you right now how you can add case notes in HMIS. But you are correct that that error is causing problems for all of us, and it's been happening, I think, since December 3rd. And our hope was that it would be resolved long ago. Unfortunately, there's nothing that we can do to fix it. We're waiting on AdsysTech, the people who make our HMIS software, and so until they correct the error, there's not a lot we can do about it. So if I wanted to attach services to my case note, this example I'm using right here, I could go to this services. I would drop down that menu. I would choose the appropriate service, and then I would click that green down arrow, and then that service would show up right there. Whoops, sorry about that. So unfortunately, this is an issue with HMIS right now, is that we cannot attach services to our case notes. So let me see. Okay, yeah. So hopefully this error will be resolved in the very near future. I don't have an estimated date for when this will get corrected, but I really hope that it will be in the near future. In the meantime, if it's essential for you and your program to track the services provided during a case management encounter, there are a number of different ways you can do that, and I would, again, make sure that your entire program does this the same way. But you can document your services in your actual note. Oops. So you can just type them into the note itself and save. Oops, ignore all. So you can type it into the note itself like I've done here, or you can wait to add these services until this issue is corrected. So once the issue is corrected by AdsysTech, you can go back and add the services to your existing notes, or you can contact the data team at 9999 or data@coloradocoalition.org, and they need 3 pieces of information in order to correct this for you. They need your client's name, they need the program, and they need the date of the note. And it's just on a note-by-note basis. They can fix it for you. So if you've written 50 notes, we can go one by one and correct each of those notes for you so that you can add services to them, but we need those 3 pieces of information for every single note. So we need to know the client's name, the program, and the date of service for each note, and we can go correct them one by one. And that's kind of the best workaround that we have right now. So unfortunately, it's not fun for you and it's not fun for us. So hopefully AdsysTech will get this issue fixed for us shortly. I got another question that said, can you explain how to break down time for services under the services option on the left? Yeah, so there is no time associated with services that you attach to a case note. The case note, when you fill out a case note, you enter the units of service, the number of minutes right here in the units field on the case note. There is no time associated with these services down here. And there's no way for you to associate time with that, because if you said, this employment assistance service that I just provided right here that I've attached to my case note was 15 minutes, well then it looks like not only did you spend 50 minutes, but you spent an additional 15 minutes. So now you've spent 65 minutes. Okay, so there's a clarification that says, I don't mean how you, let's see, I don't mean under the case note, I mean under services. So we are no longer documenting on the services page. Face-to-face, one-on-one, case management encounters are all documented on the case notes page. Unless you work for one of those programs that I listed as the exceptions earlier in the webinar, you are no longer documenting this page. So I'm not going to talk about how to do the services page. I'm not going to talk about how you assign time there or what you do there, because we're not using that page anymore. We are moving forward, standardizing our documentation by everyone using the case notes page to document one-on-one case management encounters. Okay, so hopefully that answered the questions. And all right. So finally, there are obviously times where we provide services that don't match the one-on-one case management encounter criteria. So you have group sessions or services that you provide to multiple people, or services that you provide that aren't case management and aren't face-to-face. So those things are going to be documented in the group sessions in HMIS. So in order to document a group session, you can go to the group sessions page. It's under the program client search. And you find the program that you want to add on the under the program drop-down list. So here you can see there's a drop-down. You would choose the appropriate program, and this program component field populates automatically, so you don't have to do anything with that. You just choose your program, and the program component is going to happen automatically. And then you can search for your client by last name, by their identifier, which is the 7-digit number that's attached to them in HMIS. And then you click the search button. Or if you want everybody who's enrolled in that program that you selected earlier, so the program you selected here, if you want everybody in that program, you can just leave these two fields blank and click the search button, and it's going to give you everybody who's enrolled in that program, and they will all show up on this client listing grid below the search criteria. So you choose your program, you search for your client, they show up in the list below, and then you choose your client's record. And as a reminder, the way that HMIS works, you have to choose, you can see where I'm highlighting with this, there's that little black arrow. You have to click that little gray box to the left of your client's name in order to highlight their entire record. Because if you just click the last name column, it's only going to highlight the last name. You have to highlight the client's entire record. Then you go over under the services listing grid, and you choose the group service that you want to provide. Again, select the entire record. Then you set the date of service and click the served button. So we choose the program. We find our, let me erase this. Choose the program. We find our client. We find our service. We set the date, and then we click served. Once you've done that, the client's going to show up in this client served listing grid right below. And you can also append a note to that client. So you can attach a note to one or multiple clients who attended this group session or who were involved in this group service. And that note will show up on the case notes page, but it's only editable from here. So you have to come back to the group sessions page to edit their note. So you can see it on the case notes page, but you need to come back here if you want to make any changes to it. Okay. Oh yeah, I forgot one step. Finally, at the bottom of the page, you will set the milestone to enrollment or enrolled or what. There's only going to be one option, so you choose the only option, then you set the status to in progress, and you click update. So let's go ahead and take a look at that in HMIS. Okay, so the first thing that I'm going to do is go to the group sessions page. So over on the left-hand side, I've got my navigator bar. I'm going to find the group sessions page, click on that, and that's going to bring me to a page where I can enter group services. First thing I do is choose the appropriate program. I want the Family Transitional Housing Program. So I select that program, and the program component populates automatically for me. So I don't have to do anything with that program component. And so I can search for my client, by last name. So I type in part of my client's last name, and sure enough, there's Donald Draper. Or if I'm providing a group service to many people who are enrolled in this program, I can leave these fields blank and just click the search button, and then this client listing grid will populate with everyone who's currently enrolled in that program. So anybody who I could possibly provide the service listed below. And I can sort this by last name. I can click on the last name column, and it's going to sort the list alphabetically for me. And hopefully you know this from your work in HMIS, but these listing grids work just like Excel. So I can put the last name first so that I sort it by last name and the first name comes up next. Or I can scroll over and let's say I want to have their, date of birth. So I can go last name by date of birth, and I can click the column name again to sort it from Z to A, reverse our sort order, or go back to A to Z. Just like, unfortunately, HMIS doesn't save your preferences, so the next time you log out and log back in, this will be back to the default setting. So, but for my purposes, I'm going to go ahead and look up my client. I select my client. I select the service, set the date, and click Served. So once I've done that, now my client shows up in the Client Served listing grid right there. Okay? So if I wanted to provide this service to multiple people, let me just show everybody who's currently in the program, and I want to provide this service to multiple people. So I'm going to choose a whole bunch of people. So I can choose a group of people by clicking the Shift key, holding it down, and then clicking with my mouse. And then I can choose multiple individuals by holding down the Control key, clicking with my mouse. All right, so I've chosen all of the clients. I choose the service that I want to provide. I choose the date of the service, and then I click the Served button. And so this is a way for you to provide a service to many people at a time. So now you'll see that that the Client Served listing grid shows all of those people that I just served. There's a whole bunch of people listed there now because all of those people were provided that service at the same time. So my final step is to add the milestone. So I would choose everyone in this list. Again, I do that by clicking the first person in the list, then holding down the Shift key, clicking the last person in the list. I set the milestone to enrollment, status to in progress, and I click Update. So that's the last step. Now let's say that I wanted to add a note to these clients in this for this specific service that was provided. I can select multiple, or maybe I only want to add the note to one person. You can select one person, or you can select multiple people in the list. And then you can click on the Append Note to Selected Customers button underneath the Client Served listing grid. That'll bring up a little pop-up window where you can type a note. I'm sure you will all agree with the content of my note. I click Save, and now that note, that note has been appended to the record for each of those people. So if I wanted to go in and edit that note, I would select the person I want to edit the note for, and I would click View or Edit Customer Note, and that would show me the note that exists attached to this client for this service on that date, and I could go in and modify the note. Okay, so as I mentioned in the PowerPoint, when you attach a note to a client's record on the group sessions page. It shows up on the case notes page, but you can't edit it from there. So I'm going to show you what that looks like. So I attached a note to Paula Abdul, so I'm just going to search for my client on the case notes page. And again, I don't see any case notes here, which could concern me, except I know that I'm looking at the wrong program. So I'm going to go in and make sure I look at the correct program by using the customer drop-down box. I provided the service in the Family Transitional Housing Program, so I go to that program for my client, and then I can see all these case notes. And I can see that, let's see, here's the one with my date. I provided this life skills group on January 3rd, 2013, and here is the note that I typed. I know that this is a group service because the activity listed here is life skills group. And as you will remember, the only options that you have for activity available to you on a case notes page are case management, client present, telephone, no contact, or other. So there is, if you see a different activity listed here, that probably means that it's a group service. So if I see this note and I think, oh, this idiot spelled I'm wrong or didn't use a capital letter at the beginning of their sentence, we should correct this note. I know that because of this activity type, I need to go to the group sessions page in order to modify that note. So hopefully that makes sense. Looks like I have a question here in the chat. Is there a duration for group services? Sometimes I do all-day group activities and sometimes only 1 hour group activities. Or is there no need to track group activity time? So that's a really good question. There are a couple of different methods. So you noticed when we are on the group services page, there's no place here for you to put in the amount of time. So there's no place where I can say, here's the number of minutes that I spent doing this group service. So a couple of options are that you can either create, well, you can't create them. You can contact the data team to create services for you so that you can have, you know, all-day shopping trip is a group service, or 2-hour shopping trip is a group service. And both of those things would show up on your service listing. So you would have all-day shopping trip, 2-hour shopping trip. And depending on the day, if you did an all-day shopping trip, you would highlight all of your clients. Then you would choose the all-day shopping trip option, which obviously isn't here right now, but I'm making it up. And then you would click Served. But then the days where you did the 2-hour, you would choose the 2-hour service type. Or it might not be important that you track that information. So you could also put it in the note that is attached to the client's group service, or you can ask for different services to be created for you. But I would definitely talk with your supervisor and ask them about how they want you to do that, because on the group sessions page, there's not an easy way to track the duration in minutes for each service provided. So, so I would definitely recommend that you talk with your supervisor and kind of figure out, work out with them, work out as a team how you're going to record that, or if it's even necessary for you to record that information. Okay, hopefully that answered your question. So now we are going to open it up for the audio Q&A. I am finished with my portion, so I'm going to unmute everyone's lines. So if you're all talking smack about me right now, now's a good time to, you know, finish up your last-minute jabs, and then remain silent so that there's not a lot of background noise, because there are a lot of people on the call today. So I'm going to unmute everyone's lines. Then you'll be able to ask any questions. We can talk through those questions, and then hopefully we'll be finished. So I'm going to unmute you all now. Oops, I pushed the wrong button. I mean, now I'm going to unmute you all. So there we go. So now you can hear me. Hello, everybody. So now you can hear me, and I can hear you, and everyone else can hear you. So don't say anything embarrassing. All right. So let's go ahead. Does anybody have any specific questions that I didn't cover or were unclear?
So, Jess, I just wanted to clarify, we're not supposed to use the service page at all anymore, period, right?
Correct.
Okay.
Yep. As long as you are not one of the groups that I mentioned in the exceptions list at the beginning, which I know you're not. So the people who have the exceptions can continue documenting the way that they have always documented. But if you are not on the exceptions list, then everyone is moving to the new method, which is case notes for basically everything except for non-one-on-one case management encounters.
And then if the little service box doesn't work, it's okay to just put the services directly into the case note and call it good for right now?
Yep. I mean, I would just check with your supervisor and make sure that that's okay with them. I know there have been a couple managers who have asked their staff to wait until the issue is corrected and then to go back and add the services. So it kind of depends on what your manager wants you to do. So there are some programs who don't ever even do that. They only enter a case note. They never attach services. So it's really up to your kind of program manager or your director to determine what's important for them to know. So do they really want it broken down by the different types of services, or just recording the case management is enough? So, so if that is something that you have done in the past, is attaching services to the case note, I would assume you're probably going to continue doing that moving forward. And so it's just a matter of asking your supervisor how they want you to do that while we're in this stage of uncertainty.
Okay, thank you.
Mm-hmm. Any other questions? Okay, then I have put up a slide that shows the data team's email address and phone number. If you're able to dial by extension, it's extension 999. What?
I think that's just background noise, Jess.
Oh, okay. So extension 9999 if you can dial by extension. If not, the full telephone number is up there, 303-312-9999. Or you can email us at data. So if you have any questions, we can definitely answer kind of technical questions or system questions. If you have questions about appropriate documentation, we are probably not the people you want answering those kinds of questions. So again, that's a good place to talk with your supervisor, your clinical supervisor, or maybe your program manager to ask for assistance. So one last try. Does anybody have any questions?
Oh, no, that's, you can't really hear.
Thank you, Jess.
Okay, I'm going to take the that background. Yeah, thank you guys so much. We'll be done now, and we will send out anybody who put in their information needing the PowerPoint emailed to them. We will send that to you here shortly, and we've got you all written down for attendance. So thanks so much.
Thank you.